Every journey gets us closer to the same truth. We all need connection.
You are watching In Conversation This Week with Miceal O'Hurley.
This is Miceal O'Hurley with Diplomacy in Ireland, the European diplomat. I'm reporting from the Antalya Diplomacy Forum. I'm joined by Her Highness. We just left a healthcare panel, which was quite empowering. What did the pandemic expose in terms of equality in healthcare, in your opinion?
As we have seen with the pandemic has ironically made us to don masks, and yet it unmasks so many gaps in the current global health infrastructure. And we really saw that play out very clearly, especially with the issue of vaccine sharing, the fact that really the high-income countries and the big companies that supplied the vaccines really hoarded the vaccines. And as we stand today, for example, Africa only has had 10% vaccinations compared to 80% in high-income countries. And the global health infrastructure needs strengthening. A lot of the global instruments, international health regulations, governance, legal norms, patent laws, intellectual property rights on medicines and sharing of information and technology really are outdated, are unequal, unfair, and certainly they put profits before health, and they need to be reassessed and updated. And the World Health Organization, as a result, it needs to be strengthened. We need a multinational organization because we saw that goodwill alone doesn't cut it. We cannot wait for countries to have a good conscience to do the right thing. We need an objective multinational organization such as the WHO. Even though it's not perfect and it needs fixing, let's fix it. Let's finance it sustainably. Let's update the laws and the rules for future proper preparedness, and really work on part of it, working on building local capacity in the countries, for example, to produce vaccines, pay for the license, but be able to do it. We cannot we cannot have this monopoly of hoarding science or technology and so on, because we see, the whole world gets affected. No one is safe until everyone is safe.
Excellency, you talked about vaccine nationalism and you talked about institutions. Are you aware of any work that's being undertaken in the diplomatic community to strengthen international institutions so that we can be prepared for the eventual next crisis?
I do know that some instruments, certainly led by WHO and some other UN organizations, they are starting to, for example, the COVAX tool for ACT accelerator for, producing and distributing vaccines equitably. It did something, but, will take some time for countries to follow through. There is the mRNA technology hub transfer. So instruments are this one will be in Africa, in South Africa. So there are moves to actually, and tools and instruments to solve these issues. But what we need now is for the diplomatic community to, bring it all together. They were all produced, suddenly ad hoc, instigated by panic or the situation. But now we need, the global health community and the political community, they need to take stock and say, look, we've seen these instruments, they are having some benefits. Let's look at what worked, what didn't work, and let's put one solid plan, and it would be best really, as Dr. Tedros said, to have a proper treaty, not rely on just voluntary collaboration. It doesn't work. And the fact that we saw the decimation for economies, for lives, for health, what Corona did, I think it requires a solid binding treaty, because the whole world cannot go through something like this again.
Excellency, you're known for your leadership in cancer and cancer treatment all over the world. You spoke about the devastation in Syria, in Sudan, in Ukraine, and what that means for people that have non-communicable diseases, the diseases that kill most human beings. What can a disruption in cancer treatment and displacement mean for people suffering from cancer during a war?
Yeah, death. I'm saying it because, as a mother of a cancer survivor, I know how much following a strict protocol for cancer treatment and time is everything. Having the right diagnosis at the right time, having the treatment and the protocol follow the right time. I cannot imagine for 1 second what it would mean had I been a refugee and with a child that has cancer, not having the medication, not having the everything, right? We should be, half the time you're doing all of the workup for cancer in a hospital setting and so on. They would just simply die. And when I was Director General of the King Hussein Cancer Foundation in Jordan, it was the Iraqi and the Syrian refugees who came. Jordan is a big host of refugees. And I remember being shocked because I didn't know, for example, that UNHCR or WHO don't have actually the funds or even any system to deal with cancer patients caught in conflict. And so what happened at the time is that the foundation, we took it upon ourselves to open accounts for Syrian patients, Iraqi patients, and to get from people and, from the region or from abroad who want to help people. And of course we helped save quite a few, but of course as a small NGO we cannot take on whole countries. And it was quite shocking to know that was the case then, and even more shocking that even now with these days having the highest number of refugees the world has ever had, and now with the Ukraine another 2 million and so on, the global system has to decide that refugees are human beings who are not just facing injuries or emergency type thing. They can have communicable, they have non-communicable diseases, they have diabetes, they have all sorts of things, and we have to have systems in place that also doesn't just burden the host country. That's the thing. Half the time it's like in Syria, 3 countries took all of the refugees mostly: Lebanon, Turkey, Jordan, and it has its effects on the host country. The global community, who's had a lot of actually hand in that conflict, they cannot just lift their hands off that. There has to be a system that everybody helps. Number one, the refugees, and contributes to their well-being, whether they stay with them or not stay.
We've talked about a lot of sad issues.
Yes.
Highness, the Hashemite Kingdom of Jordan did a huge pivot, took ownership of its cancer system, transformed it. It's really a model for the world.
Yes.
And it's not only allowed the people of Jordan to get the best health care in the world, especially when it comes to cancer, but to accommodate the Palestinian refugees, the Syrians who come to you, the multitudes of people who come to Jordan.
Yes.
How much does individual leadership in healthcare mean to creating a successful healthcare system with equity?
Everything. I think if you have political will and you have the moral and ethical outlook, of course, leadership is everything. Because then the country moves in that direction. And Jordan has always had great leaders, human leaders, I would say. And we've always opened our doors to who needs it.
Your Excellency, I appreciate you taking your time. This is Miceal O'Hurley with Diplomacy in Ireland, the European diplomat, reporting from the Antalya Diplomacy Forum. I've been joined with Her Highness, Dina Mired. who is an excellent advocate for healthcare, a great humanitarian. I want to tell you a last story.
What?
I was working with Queen Noor on a skin disease, epidermolysis bullosa, and I had her personal phone number in my mobile phone. And one day my 2-year-old handed me the telephone, and it was Queen Noor who complimented me on having such a nice little girl. So I want to again express my gratitude to Jordon and you for your personal leadership in healthcare equity, and especially cancer treatment.
Thank you so much for this interview, and we thank also Ireland for always speaking out for justice. On all issues, and especially about Palestine. Thank you for that.
It's one thing we can always agree on is the Palestinian people are also waiting for justice.
Yes.
Excellency, have a good day.
Thank you so much. Thank you. Thank you.
300 million years ago, there was no Africa, Asia, Americas, or Europe. Just one big supercontinent, Pangea. And today, there is still a force connecting those divided by distance, reversing millions of years of rifting. Making far feel close, bringing there to here. Turkish Airlines.